Hi, how are you?
I'm good. How are you?
Good. Thanks so much, Angela, for joining me today to talk to women about what is kind of a really common topic. It sounds like 1 in 3 women will experience urinary incontinence in their lifetime. And
Yeah.
I know there's a few different kinds of incontinence. So, can you just talk to us about what has been your experience with women and incontinence, and maybe tell us about the most common types of incontinence that you see?
Sure. So in women, there tends to be two different kinds of incontinence that are the most common. So the first would be called stress incontinence, and that's all about leakage that happens when there's pressure. So if you cough, if you sneeze, if you exercise, lift a heavy pan, take a big gallon of milk out of the fridge, anything with pressure, you could have some leakage. So that's called stress incontinence. And then the other main type is actually kind of a two-named thing, overactive bladder / urge incontinence, because many women have overactive bladder symptoms, but they don't actually leak. If you do leak on the way to the bathroom, that would be called urge incontinence. So that's all about, so overactive bladder is, urinating much more frequently than normal. So normal is kind of considered every 2 to 4 hours and 0 to 1 time at night. So if you're going more often than that, it starts to fall into this bucket called overactive bladder. And if you have urgency and you're running to the bathroom and you know every bathroom all around town, that tends to fall into this overactive bladder, and if it leaks, it's called urge incontinence. So, and many people actually have symptoms of both. So those are the two kind of main kinds that women tend to suffer with.
Yeah, thanks. That's such a great way of explaining it. And those are the most common 2 types. In fact, I think the most common type is stress incontinence. Can you talk to us about why that occurs for women?
Well, stress incontinence can be, so people always think, oh, well, that's just for women who have had kids. And it certainly can be, because having a baby, certainly whether or not it's born vaginally or C-section, that can be pretty stressful to our pelvic floor. But there are plenty of people that have leakage with coughing and sneezing who have never had a child. And so I say that so that they don't feel like, what's wrong with me? The problem with pelvic floor issues are that many people are very isolated. They think they're the only one. Nobody else has this, and that couldn't be further from the truth. These issues are so common, and there's so many really effective treatments for it. So I'm always trying to kind of get that information out there so people will take some action and not suffer in silence with these issues, because it's not normal. If you have leakage, something is not working right. And so you need to strengthen and it's not just exercises. There's other things you can do, but there's things you can do to get rid of that so that your body's functioning better.
Yeah, so we don't have to live with incontinence, and this is what you specialize in, is pelvic floor therapy. How did you get into this, and how did you kind of find your niche?
Exactly. Well, I loved physical therapy. I always had kind of an interest in, having babies and what happens to your body when you are pregnant and what happens after you have a baby. And oh my gosh, there's this niche of pelvic floor therapy that you can help women after they've had babies, because there's so many issues that can come up. And so it just kind of fascinated me. So I started taking continuing education classes and I had a mentor who helped me start treating. And honestly, I just got so excited about it because very simple changes could make a huge difference in problems in this area. And I thought, oh my gosh, people don't have to suffer with this. And I knew how common it was. So it was just a pretty exciting kind of thing to discover that, oh my gosh, all these different things that we can teach a woman and a man, but we're speaking about women right now. It can really be effective. And if you can stop someone from leaking or other pelvic health issues, if you can fix those issues, it can really improve their quality of life. So it's a pretty exciting niche, actually.
Yeah, that's amazing. And so tell us a little bit about women with stress incontinence and what sort of things you do to help them control stress incontinence.
Yeah, so kind of the first thing you do is just educate somebody about what stress incontinence is, because it's really all about managing pressures. So if you cough, if you sneeze, there's this pressure coming downward, and you have to be able to balance that pressure from below. And if you don't, you could have leakage. So what's making that area not be able to handle that pressure? Are the muscles too sluggish? Are they too weak? Are they just not coordinated? Are the helper muscles of the pelvic floor not coming in like they're supposed to? And so our first visit is just discovering all these different things, looking at you, how you use your body, how strong, how weak things are. And then we go, oh, okay, this is what we need to focus on to get things better coordinated and stronger, so that when you cough or sneeze, your body's able to control that pressure better. So that's kind of like the start of it. But then there's some
Great.
specifics that we teach people too, of course.
Yeah, so it starts with education, and then what sort of exercises do you teach?
So I kind of focus on 3 areas. So the first one is kind of the famous Kegel. And so there's a lot of education that kind of comes around what are Kegels, should I be doing them, and how do I do them? And pretty much almost any woman that comes to see me that is asking about pelvic floor problems, they'll say, well, I've tried Kegels, they don't work. But then when you ask them about that, well, how are you doing them? Well, I occasionally would tighten them and then I would let go. Or when I was at a stoplight, I would do a few. Or I never really did them that well because nobody showed me how. Well, then of course they're not going to work for you. And it's so strange that we think if we just tell a woman do Kegels and you'll be better, it's so crazy to think that they'd actually get better because no one exercise can ever fix anything, you know? So we really start with Kegels. Okay, should you be doing Kegels? People who maybe shouldn't be doing Kegels hold a lot of tension in their pelvic floor. And that can look like somebody who has a lot of pelvic pain or a lot of back pain or has constipation, or there's some different signs there that maybe they actually have too much tension in their pelvic floor. And for them, we don't want to start with Kegels. We want to work on relaxing and then strengthening when they're able to. But if someone just does come and you talk with them and it does look like they have a weak pelvic floor, then we can start with Kegels. And to do a Kegel, you're really just in good posture, pulling up and in on your pelvic floor. And we do 2 kinds. The first one, we try to hold for 10 seconds and relax for 10 seconds and do them in sets of 10. So that's really where the key is, the dosage of how you're doing these exercises. It's just like if I lift a weight once or twice, it's not going to hurt me, but it's certainly not going to get my biceps stronger. Well, if I just do an occasional Kegel at a stoplight, it's not going to do anything. It won't hurt me, but it certainly won't get me stronger. So it's doing repetitive sets, it's doing enough of them, and doing the types that you need. So we just talked about the longer 10-second holds, but there's also these quicker ones that we do. So it's a squeeze and let go, squeeze and let go, squeeze and let go, squeeze and let go. The fast ones are super important because if you cough or sneeze, those muscles have to come in quickly. So we're really training these 2 parts. There's 2 parts of function of our pelvic floor, and there's 2 types of fiber that match those functions. And so those 2 types of Kegels are really trying to target those fibers. So it's a much more specific way to do Kegels than just this kind of flippant way, someone telling you go do your Kegels.
Yeah, I love that. That's great because most of us just think, okay, you hold your pee when you're going, and that's the exercise you need to use when you're not going. We don't want you to do it all the time when you're on the toilet.
Exactly.
But those would be the exercise muscles that would kind of cinch off the urine stream. And so, yeah, that is sort of the traditional teaching, but it's great to know that you're right. You can't just go to the gym and lift a weight twice and develop a new muscle. So that's awesome.
Right. Exactly. And then the second one is really thinking about abdominals, because the abdominals, especially the deepest layer of the abdominals, really help to reinforce what your pelvic floor does. And a lot of times things like sit-ups, things like there's different exercises you can do that are great for parts of your abdominals, but don't necessarily help to reinforce the coordination of the deep core with the pelvic floor. So just a very simple exercise is, again, sitting up in good posture. It's starting with a relaxed belly and then drawing it all the way in. And as you keep breathing, hold for 10 seconds and then relax for 10 seconds. And again, you repeat a full set of 10 because we're trying to strengthen this set of muscles. And if you can't, a lot of women can't hold for 10 seconds right away because those muscles are really weak. Well, then start with wherever you're at. If you can hold it for 4 seconds, you hold it for 4, rest for 4, do it 10 times though. So you want to be tired at the end. You want your muscles, the muscles you're working on, to always be tired by the end of the sets that you do. So that's the second main one that we start with.
Yeah, that's great. And I think a lot of us don't think how much the deep abdominals engage the pelvic floor, right? I mean, we don't think that way. So that's great to know that you're incorporating that.
And why would we, right? Like everything you read about is like the 6-pack. You don't really read about that deep layer. So yeah, it's good to kind of start getting that all charged up. And then finally, the last one, because again, we're talking about stress incontinence, so leakage with coughing or sneezing. We want to do something called the knack. And what the knack is making sure the timing and coordination of those 2 sets of muscles we just talked about are coming on right before that cough or sneeze. So to practice that, you're again sitting in good posture. Note we've said good posture 3 times because that's your body functions much better when it's in a good posture. You're going to pick up your pelvic floor in a Kegel. hold it, keep adding your tummy, pull your tummy in. So now we've done both of the first two muscle groups. And then you hold it as you clear your throat. And as you do that, you should feel that you've managed the pressure below. If you feel that you have this downward pressure, you got to start again and maybe lighten up the pressure. Instead of clearing, you might want to just do like a shh, shh, because you have to make sure you're managing the pressure, because we're going to be practicing it like an exercise. So the whole goal is pelvic floor up, tummy up, and relax. So you're working on the quickness and the coordination of that, because your core has to come on right before the pressure does. You practice that as an exercise so you get good at it, so that now every time you sneeze, every time you cough, every time you pick up a gallon of milk or do pressure, you're going to pre-tighten your pelvic floor. So now you have that protection. So those are the three main exercises that we target.
That's great. Yeah. And I love that you're tying it to the core and the posture, because I think that's really key for wellness, not just in the pelvic floor, but in the lower back and in all the areas that you probably see patients have complaints commonly. So great.
Exactly.
Thanks for explaining that so well. And I know patients are really going to be interested in learning more about what you do and how to reach you, especially it sounds like if they're having incontinence issues. So how should patients reach out to you?
Yeah, sure. So I actually do all my work virtually. And really, I did that with intent so that people could access this a little easier. It's really hard to find a pelvic therapist. There's not a whole lot of us out there. Find a place that doesn't have a waiting list, take off work, get a babysitter. There's so many barriers to just getting into therapy. So I see everybody online. I'm licensed in 4 states. So I'm licensed in Illinois, as well as Colorado, California, and Florida. And anyone that's interested in finding out more can find me at, my business is called mypelvictherapy.com. And I do free consultations with everybody. So I would encourage anyone that might be listening, if they have any questions or are curious at all if pelvic therapy is right for them, or if whatever we're talking about, does it resonate? Is it something they should do, shouldn't, or they just don't know what to do, to just sign up for a free consultation. And there's no obligation whatsoever. We just talk for free and just try and figure out, okay, where are you at and where do you need to go? So, so you can reach me to do that on mypelvictherapy.com.
Great. Thank you so much. We really appreciate you coming and sharing your expertise and educating us and spending the time. So thanks for your time today.
Oh, sure. It's my pleasure. Thanks so much for the invite. I appreciate it.